So today we're gonna start very important topic, the tumors of salivary glands. So let's start in Bismillahirrahmanirrahim. Okay. So basically, you know that saliva gland. The function of saliva gland is basically it secretes the saliva. The saliva has a lot of function. Then we come across. You have also studied in your first year. Very important. So basically, it is a group of compound of exocrine glands secreting saliva. Exocrine glands are those glands which have ducts. Okay, always remember if someone asks you that salivary glands are exocrine or endocrine, always remember it is exocrine because it has ducts and like Stenson duct, Warden duct. Okay, so always remember it. Then it is divided into three major salivary glands. You have parotid, which is serous. Always remember, very important. Submandibular gland is mixed basically, and sublingual has mixed, but mucus secreting unit is dominating one. Okay, always remember. So parotid one is serious and submandibular is mixed. Okay, sublingual is also mixed, but mucus is basically the predominant one. Then you can see the whole structure of the salivary glands measure. So the parotid gland is here. Always remember this is a parotid gland, and the tail of parotid gland is present at the angle of the mouth. It is very important that you should know. Then you have actually the submandibular gland, and submandibular gland is present here. Basically it is submandibular gland. Okay, is present here. Sorry, it is present here. Okay, and then then you have some lingual gland. Okay, and you can see the Wharton's duct. Wharton's duct is of the submandibular gland, and the tension duct is of the parotid gland. This is, you have mylohyoid muscle is also down of this. You can see here the whole, you have parotid duct, which is tension duct. Okay, then you have parotid gland here, then you have mesostem muscle here. Okay, submandibular gland, then you have tongue, sublingual, submandibular, and then you have mandil mandibular. Okay, so minor salivary glands, we it is mostly 6 to 1000 minor salivary glands are present, which is basically you have labial one, buccal one, palatine, and then you have von Ebner's gland. Okay, so very important. Now coming towards the salivary gland components. Salivary gland components have two components. So basically what it has the oral epithelium, parenchyma element. It has na parenchyma element. So number one is oral epithelium, and then you have acini, basically that produces the saliva, then it leading to the ducts that eventually open into the oral cavity. The connective tissue forms the capsule around the gland that is extended, and then dividing groups of secretory units and duct into lobes and lobules. Very important that the saliva has two components. The saliva has two components, which is parenchyma element. In parenchyma element you has oral epithelium, then you have acini. In connective tissue you have capsule basically in this. Okay, then you have the whole structure of the salivary gland component, in which you have acini here, myoepithelium cells you have, then you have intercollected duct you have, then you have striated duct here, and these are the cells of the ductal. The whole salivary gland is here. You can see the myoepithelium cells. Myoepithelium cells has a function of contraction. When these cells contract, so they push the saliva into the ducts. Okay, into the intercollected ducts. Then the intercollected ducts comes into the striated one. Then the striated goes into the excretory duct, which is the major duct. Okay, you can see the mucous cells also. Acha. Here basically SNI, then intercollected duct, striated, interlobular or excretory duct you can say. Then you have Stenson, yeah, Watson duct you can say. Then you have classification, very important. What are benign, pleomorphic adenoma you can say, basal cell adenoma you can say, myoepithelioma you can say, Warden tumor, oncocytoma you can have it, or papillary cyst adenoma. Then malignant you have basically mucoepidermoid carcinoma, acini cell adenocarcinoma, and adenoid cystic carcinoma. Very important, adenoid cystic carcinoma. You have basal cell adenocarcinoma, salivary duct carcinoma, etc. you have. Then coming towards the most important is basically here we have